Hi, let's talk about the changes that are coming to your 2025 Medicare plans. Now we have to talk about the past in order to talk about what's coming up here pretty soon. So the Inflation Reduction Act of 2022 is what got this whole thing started. So back in 2022 is when the adult vaccines became covered at 100%. So for folks who wanted that expensive shingles vaccine, that was now no cost. The next year was when there was a cap on insulin prices for $35. Great improvement there. And then what we saw was the covered costs for prescriptions once you hit the catastrophic stage. So for folks who were on very expensive medications and they made it through their initial phase of prescription drug plan, then into the donut hole, and then into catastrophic stage, once they hit catastrophic stage, their drugs were covered at no cost, bringing a lot of relief to people. That's what this year's 2024 change was. So for 2025, things are really gonna get shaken up. So there's a couple new things happening. The donut hole, also known as the coverage gap, going away. So what does that mean? Because for so many people, they get put into the donut hole every year and their costs go up because all of a sudden they start paying 25% of the real cost of their medications. So for those folks that are in that situation, there is going to be a maximum out of pocket that you'll pay for your medications throughout the year. That maximum number is $2,000. In addition to the $2,000 maximum, you're also going to have the opportunity to enroll in the prescription payment plan. So this is going to be offered through the company that you have your prescription drug coverage through. So if you're on an Advantage plan, it's going to be where your prescription drug coverage is in that Advantage plan. Or if you're on a prescription drug plan, a standalone prescription drug plan, it's the company that has that prescription drug plan. And so what it'll allow you to do is to evenly spread the cost of your medications over the course of the year. So if you're in a plan that has a deductible and you're used to paying maybe $400 or $500 those first couple months of the year, and then things go back down and you pay the copays, you'll have the opportunity, instead of taking that big hit in the first couple months, to spread that out evenly. That's good for everyone's budgets. Rolling this out might be a little bit tricky. It's not going to happen at the pharmacy. You're not going to be paying the pharmacy if you're enrolled in the the prescription payment plan, PPP. So you're actually going to make your payments to your insurance company, whichever one that is. And when you enroll in it, you're going to enroll through that company, not through the pharmacy. So that's the big changes that are going to be kind of confusing to people what your new options are. So those are the good things. A cap at $2,000 on your prescriptions, the ability to spread that out evenly over the year. Now let's look at the negative side. The funding model for prescription drug plans is completely changing. So on the backside, things that you don't see, who has been covering the majority of the cost of your prescriptions in the past has been Medicare. That is transitioning, and it's now going to be the insurance companies. So because of this, we're going to see some changes in costs of the plan, benefits. If you're looking at Advantage plans, some of those benefits may be pulled back so that they can absorb the cost of the medications better. Deductible is going higher. You may see deductibles on some plans where you never saw them before. And then the monthly cost of those standalone prescription drug plans is estimated to go up significantly. Here are some other things that may be happening. There might be some more restrictive drug formularies on these plans. That means that the drugs you're on may not fit nicely with the plan that you're currently on, and we might have to look at some differences. The pharmacy that you choose to go with may not be the one that works with your prescription drug plan that'll cover the drugs you need. So those are going to be some of the things that you're going to be having to decide. Do I look for drug alternatives so I can stay on the plan that fits with my pharmacy? Or do I change my pharmacy so that I can get on the plan that covers the drugs that I would like to be on? Those are some of the tough conversations we're going to have. Also, they're expecting for prior authorizations to increase and step therapy, where alternative drugs are suggested to be tried out first instead of higher costing drugs. So with this, it is extremely important for you to be meeting with a licensed agent this annual enrollment. This means an agent who has their Medicare certifications, who has gone through the trainings so that we know what is happening and how to help you. There are a lot of folks who help people that are not licensed, and in this situation, in this year, it is really important to work with a licensed agent so that you can see all of your options. Also, one of the things that is required is that the agent you're working with tells you how many companies they work with and how many plans they have available. You want to work with an independent broker who has access to a lot of different companies, because you may be needing to enroll in a company that you haven't considered in the past, but your prescriptions and the costs and situation may need you to look at different options. So working with an independent agent who has a lot of access to other companies and has a good knowledge base of those companies is going to be really important. We would love to help you at Mills Insurance Services. You can give us a call, 316-395-9933. There's going to be a link in this video to where you can go ahead and schedule an appointment with our agents to go ahead and get on the books for annual enrollment for a phone conversation. If you are in Kansas, Missouri, or Oklahoma, we would love to be able to help you.